Welcome to Gross Anatomy.
So we are live with Gross Anatomy podcast, the show that explores the sights, smells, and sounds of medicine and how it pertains to pop culture.
And movies and TV and books and the world around us and even dogs. It applies to dogs today. Actually, my dogs are barking at the gate. Hang on. What are we doing with you?
We don't know. We are
our own Gross Anatomy episode of Raya O'Neill's health issues, I think.
I did it on purpose, though we had something to talk about.
Right. Maybe that's why you said okay to being the co-host of Gross Anatomy, so that we could deal with all of your illnesses.
Yes, please.
So here we are at Gross Anatomy, where we explore Raya O'Neill's illnesses, travails, and we find her the perfect doctor to come up with what's going on with her. And that's Gross Anatomy.
That's right. Yeah, I don't know. I guess what was a migraine for a week. Actually, it was a week ago on this day. And it came out of nowhere on Sunday afternoon. I was at Bravo Toast, sitting outside. They were closed. And I was like, oh, God, I just got a horrible headache. And I've gotten migraines in the past, but never this bad. Well, never this long, I should say. And it lasted the whole week. And I just kept ignoring it. And the past 72 hours. Wow, what's 4 days? 3 days is 72 hours. Anyway. It was getting worse. I was getting really nauseous. I couldn't do anything. And I was like, oh, God, let me go to urgent care after work. Left work early, went to urgent care. He told me to go to the ER. I was like, what? This is so dramatic. Go to the ER, and it was a zoo in there. Oh, my God. It was making everything worse. They told me it'd be probably like 4 hours.
I went down to look for you before I left the hospital. And sure enough, you were gone.
I was gone. I did sit outside. I was like, well, I'm going to wait outside for a while. So I was outside for maybe like 45 minutes.
Right.
And then I was like, I got to get out of here.
Yeah.
Went home.
Yeah. And how do you feel, though?
My biggest thing was the nausea. I hate being nauseous. Like, I don't do anything.
I must tell you, does anyone actually like being nauseous?
You're right. Who likes being nauseous? If so, you're a weirdo.
It's a horrible thing.
But I got what's called the migraine cocktail.
Ooh, where?
Then I went to UCLA Health. Is it called UCLA Health or?
I don't know.
Whatever. Went to that hospital yesterday, and they took great care of me.
Oh, good. Good.
So now I'm feeling better, just tired, but
Yeah. So, I get migraines too, but luckily it's not that often because they're horrible. How often do you get them?
I haven't had one like this in like 3 years.
Yeah. And it's, just when you think, hey, am I outgrowing this thing? One just sneaks up on you, right?
So what do you do?
I load up on 1,000 milligrams of acetaminophen, also known as Tylenol. And I take 800 milligrams of ibuprofen, also known as Advil, right away, as soon as I know I'm getting it. And then amazingly, what I found works is there's topical numbing cream that cosmetic doctors use, before they'll do some kind of procedure. I find if I smear it all over my forehead, even and down to my temples, it's not that it makes it better, but it makes me able to, between the Tylenol, the Advil, and the schmear, I'm somewhat able to function, somewhat.
The schmear, really?
Yeah, I discovered that. And you really have to be careful, that you don't put too much in, because if it goes in your eyes, you'll be in trouble.
Right.
And you don't want to touch it. You have to remember not to touch it, because then you'll touch stuff. And so it kind of is, it's a little challenging, or if you get sweaty, but for me, I found that those two things, it doesn't make it necessarily go away, but it makes me okay enough to kind of function.
I know, that's the thing.
Yeah.
I have a pretty high pain tolerance too. So I probably should have seen the doctor on Wednesday or Thursday, but I was like, it'll get better. I was going to the gym. I was working out. I was like, whatever.
Wow. Do you get so there's something called a prodrome before, do you get any signs, symptoms before your migraine hits?
No.
So it just hits.
Yeah. I have friends that get those auras, visual.
Yeah. I'm lucky or unlucky in that I get that aura. So I actually lose vision for a little while. So I really know it's coming, So like one time I was doing a surgery with my partners, and luckily I was just helping. And I was like, guys, we got to find another one of our partners to help you on this surgery. And it was the middle of the day and we were able to do that. And I kind of hung around, but for at least 5 to sometimes even a half hour, I lose central vision, which is the most bizarre thing. Like you could see around, but if you look straight ahead, there's a blind spot. And I remember the first time it happened, I was a kid, believe it or not, sitting on the computer. Back then it was an Apple II Plus was the very first computer. It was this giant thing that I used because I like to, believe it or not, I was an early programmer. I wish I had been smart enough to realize that I should have continued doing it, or smart enough to really be a programmer. But I just dabbled and had like a little bit of fun doing programming stuff and games. And I remember I was playing the computer and I was like, wow, this is so cool. I can't see, it's the weird
Oh,
thing.
no.
And I remember, and then I had the worst headache ever. And then it's followed with that nausea and often throwing up. And yeah, I remember one time when I had a migraine, we were taking a drive to the country and I had to get out of the car to throw up. And my dad wanted to put his hand on my head or something while I was throwing up. And I was like, what are you doing? Like you want anyone touching you when you're throwing up? Like it was like, yeah.
And there was this, oh my God, the ER. I could have written a short novel based on all this
Should have
stuff.
written a short novel.
Well, based off the past 48 hours of what I saw in the ER. It would have been a New York Times bestseller. So dramatic.
Yeah. It's crazy.
But someone yesterday at UCLA, I guess they looked like they were at the beach because he had sand all everywhere and they had like wetsuits on. He must have gotten hit in the water with something because his eye was all bloody.
Ooh.
And he ran to the trash can and was just puking. And I was like, I'm not the kind of person that throws up when they see someone throw up. I don't mind that. But I was like, whoa, I might have to throw up after looking at this.
Yeah, it's yucky. And so are you actually now feeling better?
I am feeling better. I'm just tired.
Yeah.
And I'm trying to stay hydrated because I'm sure I was a little dehydrated.
Definitely hydration is super key. So that's the other thing I do is I drink a ton of fluids, and I also try to load up on caffeine when I get the migraine too. And I don't know if maybe a combination of all that works, or maybe it's just mind over matter. Sometimes it doesn't work and you just have to lay down, right?
I know.
Yeah.
So that's my story.
Yeah, well, I'm glad you're feeling better.
Me too.
Weren't you supposed to have a friend over? That probably spoiled your friend over.
Oh, poor Carly. She came for the weekend. Luckily, she has friends that live here from college, but...
Okay. Well, we almost got to meet. It's going to happen.
Oh my gosh, I know.
Hopefully when you're not feeling sick.
It's going to happen, yes.
Yeah.
Yes. But
so what are we doing? What are we doing today?
Well, do you know, today is National Siblings Day.
Oh, I didn't know that.
I know. So call your siblings and tell them you love them.
Or call them and yell at them.
Yeah. Call and yell at them. You have 2 sisters, you said?
I have 2 sisters, yeah. And they're actually going to be coming I'm going to be seeing them the end of this week. They're coming for Passover.
Passover.
So it's going to be exciting. Are you coming for Passover maybe?
I may be coming.
Yeah, so you'll meet the sisters. Even come for a little if you want. Okay.
Are you the youngest?
No, I'm the middle.
Oh, the middle child.
And what about you?
I'm the youngest.
And how many kids?
Just me and Myra.
I definitely will call them. I have to go into the hospital. Unfortunately, it's the weekend. This week I'm on call. The weeks that I'm on call could be crazy. And this has been one of those weeks where it's busy when we're on call. And so I've been doing a lot of late night surgery, and yesterday did 2 emergency surgeries. And so now I have to head in a few minutes to go see everybody and make sure everybody's okay.
So when you're on call, this might be a dumb question, but I know everyone's
There's no such thing as a dumb question.
You're right. When you're on call, are you on call like in the emergency room, or just for patients that fall in your realm of thyroid issues and whatnot?
That's actually a brilliant question.
Yes.
Because it's different for different groups and different doctors and different. So with us, we're a big multi-specialty surgery group. So I'm on call for myself and my partners, any of their patients with surgical issues. If anything's going on, either phone calls or a patient winds up in the hospital or is in the hospital, the person on call deals with all of that. So we have a whole bunch of patients now in the hospital who've had different surgeries or who come in with emergencies that other doctors say, hey, Dr. Cohen, can you take care of this patient? So I'm dealing with, so we probably have about 20 to 30 patients I'm dealing with this weekend.
Wow.
Yeah. Yeah.
Goodness.
Maybe closer to 20. So what else?
Wow. Oh, well, you know what they came out with yesterday is Will Smith, where he stands at the Oscars, banned for 10 years.
Yeah. Interesting.
What do you think about that?
I understand it. I mean, I get it. I think in my mind, the whole thing is, I just want to know what Jada Pinkett Smith is thinking of Will right now. Is he thinking he's my hero or he's a schmuck?
I know.
That's the only thing I'm curious about.
I also want to
because the truth is, if she's thinking he's my hero, it was worth it.
But if she's thinking you're an idiot, why would you do that then?
Right. Then it wasn't worth it. But in my mind, that's what this whole thing boils down to. If Jada Pinkett is like, yeah, you're my man, you took care of me, then I think Will did the right thing, because the bottom line is happy wife, happy life.
That's right. Well, I just saw Chris Rock said he's not speaking until he gets paid.
What do you mean not speaking? Oh, about this?
Yeah.
Was that a joke though, or serious?
No, I think he's being serious.
Okay. Yeah. I don't know. It wouldn't surprise me if the two of them at some point have a laugh together, you know?
I don't know. I don't know. Maybe.
At some point, not in the near future, but at some point.
But I'm also so sick of hearing about it. It's everywhere. Like, get over it.
I know.
There's more serious things, like Bruce Willis announcing his retirement from acting.
It's weird. What I don't totally understand. Did you do any research on what happened to Bruce Willis?
So he was diagnosed with aphasia.
Yeah. Did we talk about that yet or not yet?
No, not yet.
So I love Bruce Willis. Do you like Bruce Willis?
I like him too, yeah.
I'm a huge fan. Huge fan. Do you have a favorite Bruce Willis movie?
That's
a great one. Yes. That is definitely one I was going to say. Pulp Fiction.
Really?
And yeah, I love him in Pulp Fiction. And then the other one is that science fiction movie that I'm blanking on now.
The Sixth Sense?
No, but that's a great one too. No.
Die Hard is a good one. I forgot about Die Hard.
Yeah, no, he's been in a ton of great things.
The Fifth Element?
The Fifth Element. That's the one. Exactly.
I never saw that one.
It's a little slow, but it's really fun.
I've seen a lot of Bruce Willis movies.
Yeah. And interestingly, Bruce Willis was married to Demi Moore, who Chris Rock made the reference of G.I. Jane.
Yeah.
And I love that movie, G.I. Jane. Did you ever see the movie G.I. Jane?
No.
That is a great girl power movie, by the way, G.I. Jane, with Viggo Mortensen. I loved G.I. Jane. I think that's a great movie. So I think the best thing that's going to come out of this is that you should watch G.I. Jane.
Thanks, Chris Rock.
Yeah, seriously. I thought it was a great movie.
Okay, I'll watch it.
Do you have any idea what kind of movie I thought it was?
A great one, I think.
Exactly. So yes, so he has aphasia, which is just a fancy word for trouble communicating or trouble speaking, which is interesting and vague. You know, when they say he has aphasia, because there's a lot of different types of aphasia, of being unable to speak or communicate. You know, certain boxers get aphasia. Like I think Muhammad Ali had it because he had so many concussions that he had aphasia. People who have strokes have aphasia. People who have Parkinson's disease. You know, it's typically some kind of neurologic or brain disorder that could cause types of aphasia. And there's different aphasias. There's aphasia where you could speak but it's unintelligible, like you're talking gibberish. There's aphasia where you totally understand and you know exactly what you want to say, but you just can't say it and you have trouble speaking. And I don't know.
Is it genetic or is it caused, like you said, like from, it could be
there
caused?
Might be genetic components to it, but it's really more from different, illnesses that one could develop, whether it's a stroke, which means that for whatever reason, you don't get some blood supply to your brain, or it's degenerative or from dementia or from Alzheimer's. People who get Alzheimer's forget how to talk and they have aphasia. That's usually a late stage thing. But it could be very challenging. It could be very challenging. And I hadn't seen any recent Bruce Willis movies, but I didn't, at least the last time I saw, maybe it's been a while since I saw him in anything, I didn't notice. But it's sad.
It is sad.
Have you watched any more Oscar movies?
No. And I didn't even really want to.
Really?
I saw there's something on Netflix, like, a little like category for them, but like I don't have time for that.
Yeah. I was on a plane, so I started watching, the flight ended, so I didn't get to finish it. The Versace movie.
Oh, how was it?
I was surprised. I watched it because there wasn't anything else that I wanted to watch.
Wait, Versace or House of Gucci?
House of Gucci. Yeah, House of Gucci. With
Get your designers right. Lady Gaga, who I love.
Right. With and Adam Driver and Pacino, and I thought Adam Driver and Lady Gaga were great. I'm only about halfway through it, but I was surprised. The music was great because a lot of it is 80s stuff. So I loved the music and kind of the whole vibe in the 80s. And I thought Adam Driver and Gaga were, at least so far, I thought they were just great.
I love her. And the Grammys, which were last weekend, she did a really great tribute to, or it wasn't really a tribute. It was a song she has with Tony Bennett. Because they have an album out.
Yeah.
He's another one that's getting old.
But he's old.
Yeah, he's old. Yeah, Bruce Willis is not old. He's old.
Exactly. Bruce Willis is not old. And then on the plane, the other flight, I finally watched for the same reason, because nothing else was good, I thought. So I watched Dear Evan Hansen. Did you ever see that?
Oh, you texted me that. No, I want to see it on Broadway.
Yeah. And it's been out for a long time, and it was a play, and you heard about it, and then now it's a movie. And
is that Ben Platt?
Yeah, who I didn't love in it, even though I know he was like the one who created the whole thing.
Right.
But it is such a sad and relevant and poignant movie or show or play. Do you know what it's about?
I never saw it.
It's about mental health and mental wellness.
A suicide. He's like suicidal or something.
Yeah.
I'm gonna watch. Don't spoil anything because I'll watch it.
But holy crap. And it's, and it's young kids. So it's, it hits home to me because I have young kids, teenage kids. So, and especially over COVID and the isolation, and it's about feeling isolated. And all I could say is, wow. I watched it and I really feel, wow. And my kids haven't seen it. And I think it's worth seeing it because the same reason I love the TV show Big Mouth so much is it lets you know that you're not abnormal. It lets you know that all the crazy crap that's in your brain and in your mind that you're feeling, probably everybody goes through at some point, and everybody feels it, and it's okay to feel that way. And that's why I like Dear Evan Hansen. It was a little hard to watch, but it's definitely. It was good. It was good and sad.
I was going to say, you said something, I was going to say something. Oh, what was it?
Mental health, wellness, well-being.
And Leah just texted me. What is going on?
Wow.
Wow.
Should we call her? No. Do you want to call her?
You're live. She's going to be like, oh God, no, I can't do this.
Want to call her and put her on speaker?
Hi.
Hi, Leon.
Hello.
I'm sorry. I don't know why I'm laughing. How are you?
I'm good. What are you doing today?
I had quite the weekend.
Wait, one sec. Are you? Wait, one sec. My dad's calling me. Are you with him right now? Are you guys recording?
We're recording. I can't keep a straight face.
Air right now?
We're live. We're on air right now.
Hi.
Yeah, you're live.
Hi, Leah. You're live with Gross Anatomy.
Oh my God, I feel like I'm put on the spot over here. What do I say on Gross Anatomy Live? Oh my God.
Well, we want to have
What
you.
it is. Raya told me earlier that it's national. What was that?
What's the theme today? What are you guys talking about?
The theme is National Siblings Day today.
Oh, cute.
So call your siblings. Text your siblings.
Okay, I'm going to call Hannah and Izzy right now. That's
Yes.
a really good reminder. I do need to call them. So
No, that wasn't the theme, but Raya did point it out to us. And the fact that you texted her right now, I said, wouldn't it be fun if we just called you?
that was literally perfect timing, actually. Yeah, that I just thought of Raya, just texted her, and look at that.
I know.
And you're live with Gross Anatomy.
You're live. But
Yes.
today, I am going to be in Venice like in the next hour if you're around.
Yes, I am. So come over.
Okay, I'll just come over.
Come over after work.
Okay, amazing.
Okay, bye.
Bye. How fun.
Do you think she hates us or likes us?
I think she likes us. It's good exposure, building her brand. Oh, I wanted to talk to you about the bad nurse. The bad
Yes.
nurse.
Well, she's not a bad nurse, but yeah.
She's not a bad nurse. So for those who don't know, I briefly just like skimmed over what happened on the internet. Can you recap us?
Tell me her name. I forgot her name. Do you remember her name?
Is it Redonda Vaught?
Yes.
Yeah.
Yes. Redonda Vaught. And what happened is I think she's been a nurse for a long time. I don't know for how long, but she had some patient that she needed to give a medicine for. And I think there was some stressful stuff going on. And I think it was kind of trying to hurry and get the medicine. And these days, it's not like you just go into a drawer and get a medicine. There's like built-in security. You have to like enter the patient's information and enter into this almost like a vending machine kind of thing. It's called a Pyxis. They have these vending machine things where you enter the patient's information and the medicine, specifically the medicine you want, and maybe even the dose or how many vials, and it's supposed to be to decrease errors. But the reality is I think it's all about billing and being able to charge patients and track things. So you enter the medicine, and then that drawer opens where the medicine is, and there's a bunch of medicines there, and one specific area where the actual medicine pops open, and there's your vial of what it is, and you take it, and then you have to, if you don't use the whole thing, you put it back. And so it's for checks and balances. It's basically so Big Brother watches you. I think it's also a lot about billing, and maybe also to avoid drug abuse and things amongst staff. I mean, there are all these thoughts. Unfortunately, it does slow down care a little bit. You have to make sure the medicines are in there. And if they're not in there, or if it's an emergency and you're harried, you're like, what are you going to do? You got to, go through the stupid computer stuff. So I think she either couldn't find the medicine, and you could do an override. There's the ability to say, just give me the to kind of enter, rather than have to go through the whole thing. And I guess she took the wrong medicine. And they both started with a V. I think one was Versed, one was Vecuronium, is what I think was the medicine. Versed, which I think she was supposed to give, is kind of like Valium. It's a sedative and makes you feel good. Whereas Vecuronium, if that's what it is a paralytic. And we use Vecuronium only really with general anesthesia once someone's already under general, with their breathing under control and fully safe. And then we kind of paralyze the patient so that we're doing all the work and they don't have to do the work, and we're doing the breathing for them. But if you give someone that paralytic medicine before we're controlling their breathing and everything's safe, you stop breathing and you could die.
Wow.
And I think that's basically what happened.
Oh, God.
And she supposedly came forward right away and said, hey, I screwed up. I accidentally did this. You know, she didn't try to cover it up and didn't try to hide it. And sure enough, she's being charged criminally, as a criminal offense. And I think there's a lot of debate about whether or not, I don't know her, and I don't know what kind of nurse she is. And I don't know if this is a first time making a mistake like that or not. But the reality is, I have this morbid joke that there's only one way. There is a way. We could totally get rid of patient errors. We could totally get rid of hospital errors. We could 100% eliminate error.
Yeah.
Do you know how we could do that? Eliminate the patients. Right?
Yeah.
Eliminate humans. If we eliminate humans and eliminate patients, we're not going to have errors.
Right.
But as long as people are people and patients are patients, shit's going to happen. I never curse, but I'm cursing. Stuff's going to happen. Yeah. It's like, you come into the hospital, you're sick, and we're trying to take care of you, and we're trying to do the best we can. We're trying to eliminate errors, and that's what all these things are. But stuff's going to happen, unfortunately. And I think we need to be able to admit them and not get put in jail for them, as long as we're not criminals. Right. It's one thing if we're like that Dr. Death guy that we talked about on an earlier podcast. And if you're Dr. Death going around trying to kill people, that's a different story. Right. But if you're really trying to do the best you can and you screw up and you admit it and you learn, you shouldn't, there should be punishment. There should be remedial stuff. There should be new systems put in place, but maybe even fines, but certainly not jail, certainly not prison, because then we're never going to be willing to admit mistake. And if we don't admit, it's like with anything, if we don't admit mistake, it's what we tell kids. You have to make mistakes. It's what Michael Jordan used to say. If I didn't make mistakes, I wouldn't be Michael Jordan. Right. So I think it's horrible.
Wow. Do you think she's really going to go to jail? No.
I'm not sure. I'm not sure.
Oh, I got to follow up on that. No,
yeah, we got
to
do a follow up on that. But I think, it's just gonna cause doctors, nurses, healthcare people to hide mistakes and not be honest and not be forthcoming. Part of the problem is, with the world, I think this country, but the world, people feel like I'm going to sue you. They
love to throw that out there,
right? And they forget that they're sick. You're sick already. We didn't tell you to come to the hospital. You came to the hospital. So people forget that they're sick, and they forget that they're going to die, and they forget that we're human and we're doing the best we can. Yeah. And I get it that people are scared and people are in pain, and certainly I would freak out if someone did that to me or my loved one, but I don't know. Those are my thoughts of the day.
Pretty heavy.
Good stuff. It's a heavy episode today.
I know. My migraines, the good, bad nurse.
Did you talk to your sister yet?
I did this morning. So she got LASIK surgery on Friday.
Ooh.
But she's doing good. I'm like, I want to get LASIK. I wear glasses. I wear contacts a lot. But I'm kind of worried because you're awake when they do it, but it's so short.
I had LASIK surgery. That's a whole other story that you just reminded me. I'm going to actually post it as a story. I'm going to tell Mariano that we have to do it as a story time Sunday. It's such a good story. My LASIK story.
Oh my God, you got LASIK? Oh, okay. We'll save it.
Years ago. We'll save it. We'll talk about it next podcast a little bit, and I'll talk about it on a story time Sunday.
Yes. And next podcast, we have a very special guest. Stay tuned to our Instagram and see who we'll have on next week. But we have some special guests this month.
I'm going to get ready to go to work.
Go to work and save some more lives.
Well, thanks everybody for joining us with Gross Anatomy.
We'll see you next time.
We will.
That's it for this week. Thanks for listening to Gross Anatomy, and be sure to subscribe to our podcast so you can check out more episodes on the evolving sights, smells, and sounds of medicine. Gross Anatomy is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.